We told you earlier in the newscast about Mayor de Blasio's plan to provide free health care for New Yorkers who don't have it, including undocumented immigrants. But there are some concerns about how exactly this will all happen. Well, Dr. David Sandman, president and CEO of the New York State Health Foundation, joins us now with more on the bold proposal. Thank you so much for joining us.
Thank you.
What was your reaction to this?
It's a timely announcement. The Affordable Care Act was a game changer for New York. We made a big advantage of it. We've reduced our uninsured rate in New York to a historic record low. But there's still about 1 million people in New York State who don't have coverage. About 600,000 of them are here in the city. So it's a very well-timed announcement, trying to plug those gaps.
What are your concerns about this, if any?
It's hard to do. A lot of this effort is aimed at undocumented immigrants in New York City who comprise a big portion of the uninsured. And this is a hard time to roll out the welcome mat. We have a climate in Washington that is sowing a lot of fear in the immigrant communities, and rolling out the welcome mat and saying, come forward, it's safe to get health care, but there's also a lot of fear and distrust. That's going to be a big challenge.
And what about the burden on taxpayers?
This money's coming out of the city budget. There's no tax increase associated with it, and we do pay for people whether they have coverage or not. They show up in the emergency room, and that's often the most expensive place to get care. So getting people into the system earlier, getting them primary care, preventive care, that does make good sense.
Okay, that was my next question. So will we see these savings with preventative care as opposed to, people going to the ER? So you say yes.
If you don't have insurance, you put off, postpone, delay care, and you might end up in the hospital for something like asthma or diabetes. And we know that you can manage those conditions if you had preventive care, primary care. So getting people the right care, right place, right time, that's what the mayor is trying to do.
Okay, so we'll have to see how this all shakes out. Anything else you would like to add?
Anything that is welcome, that improves access to care and expands coverage. As I said, New York State has been a leader, before the ACA, and we made full advantage of it. But with about 1 million people to go who don't have coverage, we still do have to close those gaps.
Okay. Thank you so much for joining us, Dr. David Sandman. Appreciate it.
Thank you.